Hi, welcome to Grandville Medical Group, where our priority is building a better version of you. So today, we're going to be guiding you through our aftercare process, following your medical procedure, ensuring that recovery is smooth and comfortable. Come with me. As Grandville Medical Group, we believe exceptional aftercare starts with personalized attention. Our medical personnel will manage your progress, will ensure you have everything you need to feel at ease. Welcome to our living room, where patients come to relax and interact with other patients. And here's our dining room, where our healthy meals are served. So this is our room where patients stay during their aftercare process. And we have a patient's bed, and we have beds for any visitors at home. So no one is left out of this luxury. Now, wow, our bathroom is safe and clean bathroom for our patients. Regular follow-up consultations are very essential to monitor your progress and address any concerns you may have. We're here for you every step of the way. For more information, please text or call the number below. Bye. Welcome to Grandville Medical and Laser. This is our plastic center where all plastic surgeries are carried out. In this video, we'll be taking you on a tour to show you various amazing features that this center has. Come with me. Firstly is the reception, where patients wait when they're making payment or where they wait before going into the consulting room. This place ambience is so cool, like it is giving. So here is where patients sit down, where they can just while away time or interact while they're waiting, so like they don't even get bored. Take a look. So welcome to this fully equipped theater where procedures are carried out with utmost care and precision. Right here, our patients' imaginations match their reality. Unlike traditional naming convention, our words are named for a more personalized touch, such as Yemi, Limor, Enima, and Timmy, as you have seen. This walkway is something I really found attractive. It's not boring, like a lot of artworks. You're not just walking and like looking, let me just get to where I'm going. This place is giving. Welcome to the consulting room, where patients get to talk to highly trained and experienced medical personnel. In this room, patients get to ask all the questions that may be bothering them about their procedures, like the complications, the risks. And here's our pharmacy, where our trusted medications are kept. In this pharmacy, we have a wide range of skincare products for patients that mainly come in for skin issues and skin procedures. So we use Dermafix products, and we have our Dermafix Active Cleansing Gel, which is very, very effective. Also, in this pharmacy, we have iPads, catheters. We have a lot of products, and our patients can never run out of products. As you can see, sutures, gloves, screw covers to make sure we're protected all the way. Sanitizers. Our patients infection wear? No. And obviously, we have garments for our patients' post-op care in various sizes: small, medium, large, or even extra large. last but not the least, I bring you the best breast implant that's used for breast augmentation. Welcome to Grandville Diagnostics Center, and here we carry out CT and MRI scan and X-ray imaging. This is our magnetic resonance imaging room. Right here we have our MRI machine. This machine here uses electromagnetic waves to take detailed images of soft tissues and organs in the body. This machine right here can also be used to diagnose tumors, vascular abnormalities, and pathological changes. Fun fact, this machine right here is a live machine, meaning it never goes off. It runs 24 hours, 7 days a week, and it's always cold in here. Computed tomography scanner room, also known as CT scanning room. In this room, we have our 64-slide CT scanning machine, and this machine helps us to provide accurate and detailed images, helping us also to provide quicker diagnosis and more accurate treatment plans. This is our ultrasound room, and this here is our ultrasound machine that uses non-ionizing radiation to capture images of the internal structures of the body. And in here, we carry out different types of scans, like the abdominal, abdominopelvic, transvaginal, transrectal, obstetrics, Doppler, and many more. And of course, who's a hospital without an ICU? Come with me. Welcome to our 5-bedded intensive care unit. Our intensive care unit is equipped with the latest technology, like our CRT for those with acute renal failure, warmer, monitor, ventilator, syringe drive, suction. All these are present here to support our patients who are in need of critical care. We're committed to ensuring our patients have the highest level of care and comfort. Welcome to our laboratory. From routine blood tests to specific diagnostic tests, our laboratory is designed to deliver fast and reliable results. We combine expert analysis and advanced technology to give you accurate results. Right here in the laboratory, we have various units like the hematology, chemical pathology, microbiology, histopathology, and so on. And here's our X-ray room. This right here is used for vertical and erect examinations, while this is used for horizontal examinations. Our X-ray technology helps us to take precise and clear images, helping us to diagnose a wide range of conditions quickly and effectively. Sir.
Hi, good afternoon. How are you doing?
I'm fine, thank you.
Good. Happy to see you today.
Happy to see you too, sir.
Good.
Yes, sir. So today, we'd like you to educate us on tummy talk. So please, what's the whole idea about tummy talk?
Okay, so let me start by saying, okay, once again, it's a privilege to be a doctor, and also not only that, but also to be able to attend to as many people as possible. I will say that this is over 10 years, it's over a decade that I've been doing plastic surgery, and I've been opportune to attend to as many people as possible. So for tummy talk, or the word abdominoplasty, that's the medical word we use. So oftentimes when people come to my clinic, there is one singular complaint: doctor, I'm done with childbearing and I need my tummy flat. My tummy to go back to normal. Okay, no problem. You give me some of your, or one of your complaints. So what is the next thing? So the first thing I do is to first educate them on what tummy talk is all about. Usually I will say tummy talk is in 3 parts. One, the part of excess skin of the abdomen, because tummy talk is centered around the abdomen. Tummy talk, excess skin of the abdomen, the muscle separation in the abdomen, then liposuction of the back. That's basically what tummy talk is all about. So we have excess skin, one, muscle separation, which people refer to as rectal diastasis, then flank and back liposuction. Those are the 3 components of tummy talk. Oftentimes we do it after childbearing. So not that tummy talk cannot be done in other ways, or other conditions. So if we have people who have undergone weight loss either by themselves, exercise, diet, and some other things. The other are surgery. Maybe someone who has done what we call bariatric surgery, which are the weight loss surgery. Definitely some of them will also require tummy tuck. So those ones will probably need more than just tummy tuck. They will need tummy tuck, they will need breast lift, back lift, thigh lift, even in some cases arm lift or butt lift, But these are some of those components that are involved in tummy tuck.
Okay, sir. So, sir, are there types of tummy tucks for different body figures or?
So now, so that I will not make things too complex, so I'm just going to explain it. There's what called the classic type. Now, there's a specific landmark on the body, which we normally say this is classic because they stop at that landmark. Classic type. There's a particular bone. So if you check the groin area, we have been trained. We call it anterior superior iliac spine. So there's a bone will touch. So when we end in that place, we say it's classic. And usually it doesn't go round. Now there's also what we call extended abdominoplasty or tummy tuck. So the extended one goes beyond that very particular one. There are other types also that is being used depending on how much skin that has to be resected. But I just want to limit myself to just these very, very few ones.
Okay. You mentioned that tummy tuck can be done even before childbirth. But can there be any complications at childbirth due to tummy tuck?
No, I don't understand your question.
Okay. You said tummy tuck can be done before childbirth.
Yes.
But can there be complications at childbirth because of tummy tuck? Because of this?
Oh, no. Okay, now I guess what you're saying. So basically what you're saying is that if someone has a tummy tuck,
yes,
and now wants to get pregnant,
yes,
will it affect the person's pregnancy?
Yes, exactly.
Or make the pregnancy difficult, or there is no relationship?
Wow.
The skin will still stretch the same way as if, so there's no relationship.
Wow.
So because we are not touching the womb, and when you are pregnant, the womb expands because of the baby. It also stretches the skin approximately. So there's no relationship. So what we just basically say is that it is best done after childbearing. The reason is because we know that if you are still having children and you do a tummy tuck, by the time you get pregnant again, the whole work we have done will have been futile. But however, we also have people that they are still having children, but the childbearing is well spaced out, 5 years. Someone said, I don't intend to have any child in the next 5 years. I don't understand. So they come to you. So we get all those details from them and say, okay, you can go ahead, because since maybe you're not having children in the next 5 years, you can do your tummy tuck. There are some people that is the only solution to their problem. Oh. So because I've seen women that their tummy are so big that that woman, the only solution to your problem is a tuck. When you have another child, if you want to do anything, you can always come back. We'll be able to fix. Okay.
Hello, welcome to Grandville Laboratory. Firstly, we have the chemistry bench that consists of the electrolytes machine that runs the test for electrolytes such as potassium, calcium, sodium, and chloride. Then over here we have the semi-auto machine that runs chemistry tests such as creatinine, glucose, urea, lipid profile. Next up, we have the ELISA machines that are used to run antigen and antibody tests. Then over here, we have the urinalysis machine that is used to run the urinalysis test. The Cyflow counter machine is used for CD4 counts. This over here is the incubator that is used for our culture tests such as urine MCS, blood MCS, urethra swab, HBS tests. Over here we have the water bath that is used to incubate reagents. Here we have the dry oven that is used for sterilization. Oh, I didn't see you there. This is the microscope used to observe organisms at cellular level. So over here we have the PCR machine, polymerase chain reaction machine, used for micro investigation. We have the ESR machine that is used for erythrocyte sedimentation rate test. Then here we have the electrophoresis machine used for genotype. The hemostar machine that is used to run all the chemistry tests, including LFT, liver function test, lipid profile, creatinine test, glucose test, all the chemistry tests. It can run over 60 samples simultaneously at the same time, giving you very accurate and reliable results. So you never have to wait for too long for your results to come out when we use this machine. It is very fast, very reliable. So last but not least, we have the HumaCount machine that is used for everything blood work. It's used for full blood count. It's used to calculate your PCV, everything related to blood. This machine is used for it. They're available for you 24/7 every day of the week. We're located at plot 004 Eleganza Shopping Mall, opposite VGC Lekki. We're expecting you. Thank you so much.
In this Lagos, even if you are not a smoker and you are in traffic, you will smoke. You don't have to do anything about it. You will collect your fair share or smoke.
When you know what's causing your stress, you know how to manage this.
If you set aside 5,000 naira for your body, by the completion of a year, you have taken control of your body.
Sex has that capacity to burn calories, to improve your pulse rate, to even readjust your blood pressure. It can. I don't say amen. Amen.
So this pillow is called a memory pillow. You can see I'm touching it and it's squeezing in, but immediately I remove my hand, it has come back up. This is the type of pillow you need.
Now sometimes when you have a sharp pain, hey, my liver, you begin to, your mind will be running places. Hey, my liver, my kidney, my this, because you've not been doing tests. Then you run and come and say, doctor, wait, see my liver. They'll be asking me questions. Yeah, if you have pain here, is it the liver? Is it not? Is it?
Now, people complain a lot. They say, but you know how you see, they are very expensive. People keep saying that. But you know, if you continue on that one that is cheap, there is no value for you. It is just a matter of time. When the problem comes, you will wish you never engage. And again, you will be guilty. And one of the worst things that can happen to you as a man is have a hot hair. You know how it is. If you're sitting up and your seat catches this bag, you are close to labor. You are close to what women see in labor.
Welcome to Grandville Medical Abuja, where your journey to confidence and transformation begins. If you're considering a plastic surgery, trust me, you're at the right place. At Grandville Abuja, we specialize in helping you achieve the body you've always envisioned with a commitment to precision, safety, and personalized care. Our team of skilled surgeons and dedicated medical professionals are here with you every step of the way, tailoring specific treatment to meet your needs.
You Go say pe o. 247 me a day oh. You know strong make you dey for daycare oh. Mungo na ori me dey there oh. Can't pe oh. Moduro can't pe oh. O ti pẹ́ tí mo ti sanle oh. I've been active ajá mi sáré oh.
Whether you're here for a procedure or your normal routine checkup, we use various techniques to deliver effective results. In addition, we are thrilled to announce the forthcoming launch of our antenatal sessions, where we offer comprehensive maternity care and delivery services. We look forward to supporting you and your family in these special times.
Good afternoon, sir. You're welcome to Grandville, sir. How may I assist you today, sir?
Doctor, there's nothing good about this afternoon. I've seen the doctor 10 times for this same pain for over 3 months now. Pain from the chest going to the neck. I cannot sleep well. I can't do my work well. Oh God, as I'm talking now, I'm having it again. Doctor, I don't want to die.
You won't die, sir. You won't die. So, what we'll do now is we'll give you a Alta ECG machine.
I've done ECG before, doctor.
This is a different machine. It monitors your heart for 24 to 48 hours.
Yeah.
It's a small device that will be on your body for 24 to 48 hours while you are walking, sleeping, driving. So it will monitor your heart, that we can see where all these pains are coming from. You understand, sir?
So I will die.
You won't die, you won't die.
With our Holter ECG monitor, you have no reason whatsoever to be scared like Mr. Ikunjamilaya. Grandville's got you covered. Walk into any of our branches in Lagos at BGC, Surulere, or Maitama, Abuja to get all clues and puzzles as regards your heart resolved. Your heart never stops, and that should be okay. Visit Grandville today.
So hi. So we are continuing on our journey of aesthetics, and today I'll be talking about PRP, platelet-rich plasma. So platelet-rich plasma, How do we get it? We take some of your blood. There's a special device or a special machine called centrifuge. And for a lot of organizations, they have specialized machine that are designed to spin this blood in a special bottle in order to separate the serum and the platelets in one segment, while the red blood cell is taken off totally. So it is platelet-rich plasma. Your blood has plasma, which is the fluid that the red blood cell, white blood cell, and other substance lives in. It's like a sea that has fish, sand, so many things. So we now say, okay, let's separate every other thing and leave only one component, and that's the platelet. Why is the platelet relevant? Platelet is the cell that ensure that whenever there's a cut in your skin, it releases specific things. We call it degranulate. Then when it degranulates, it releases specific substance into the blood that will cause the activation of other substances. And in that way, they will clog your blood. So in science, it's a form of stem cell. However, study has shown that fats seems to be a better stem cell. I don't know what is happening nowadays, what is the latest. But however, fat seems to, which was the reason why I made reference to fat as a substitute for fillers, in the sense that fat is a good stem cell. And from what I've seen in my experience, when you do fat grafting for facial filling, by the time it's 6 weeks, patients tend to have a glowing skin. They glow. They just glow beautifully. So, and you need just a little quantity of the fats to do that. Now, in this time around, we are using your own blood, which is spun to separate every other thing except the platelet and the serum. Now, PRP, platelet-rich plasma, can be used in different parts of the body. I'll tell you the common areas that I've used it. One, on the face, hair regrowth, vagina tightening. Same patient that's okay, I want my vagina firmer. So we'll do laser, then we'll also inject PRP into the wall. What it does is that it causes collagen production. The same thing with the face. So when you apply it on the face, it might be aging face, you have your micro needle, you have your micro needle RF machine, then you apply it like on the face. You see some people doing it and you see blood all over the face. I don't think the blood is actually necessary. It's because they need to get the other devices that you need to put so that to help to separate the blood totally from it. I'm not going to advise that you should use blood. Now, part of the other risk involved is if you are not careful going to some centers and sterilization is not being cautioned, you might end up with other things. So you get your micro needle, you get your PRP. Sometimes you have your injection. There are some, they've designed multiple needles, tiny needles, that they will use punch and it will give multiple injections simultaneously. So you can use it to inject the face. It helps to firm up the face, so aging is reduced in the sense that the body will produce more collagen to that specific area. PRP is a beautiful product of medicine. It's a beautiful product of science. It's been used in many areas. So even the orthopedic surgeons, they use it for pain in the leg. There's a different application of PRP. For us here, aging, things like stretch marks, things like vaginal tightening in combination with laser firming could go a long way.
Today we'll be talking about pain modulation, perioperative pain modulation. That's before surgery, during surgery, and after surgery. So people have been asking, oh, I'm going for a procedure, I'm going for liposuction, I'm going for tummy tuck. How am I going to be sure that pain, I don't want pain at all. My pain threshold is very, very low. So for everybody, we have a blanket way of giving pain modulation to our patients. Now, for people that are coming, ordinarily after surgery, we continue the pain modulation for a day or two, maximum of 3 days, for patients that are coming for basic liposuction or tummy tuck procedures. Now, for patients that are having more encompassing procedures, we have up to like 3 days maximum. Okay, so patient is coming doing the chest, doing the chin, doing the breast, doing the tummy tuck, doing lipo, and perhaps doing BBL. So that person is coming for a more robust procedure, more likely to have a pain score of like between 3 and 4. So we'll say +3 or +4. We'll say, well, for that person, we want to give more than someone that's just coming for ordinary liposuction. So for the person that's coming for liposuction, during the procedure, prior to the procedure, for some people, if they are anxious, we can place them on anxiolytics, then do a low dose paracetamol. Then during the procedure itself, we give opioid. Multimodal analgesia is basically what we do. That's attacking the pain through different pain pathways, not just paracetamol. So we give paracetamol, we give ketorolac, we give the opioids as well, depending on what the person's parameters are intraoperatively. And postoperatively, we continue this, okay, for the first day. We still continue with our opioids and our paracetamol and perhaps ketorolac. The person doesn't have ulcer. Then if by the second day the person is beginning to get a little bit accustomed or settling with the pain modulation, then we now temper it down, okay? We now can give oral oxycodone, cocodamol, cataflam, and paracetamol, okay? By the third day, of course, the person is nearing going home, so we're discharging home on oral and analgesics. So if the person is doing more elaborate stuff, we don't want the person to stay too long on our opioids. I don't want to mention names for people that would want to go and source for these things from outside or from, external sources, because the opioids are characterized by tolerance and dependence, just like someone that's taking alcohol. If you take alcohol, you're an alcoholic, or you take alcohol socially. If you take a bottle today, the next time you're taking alcohol, after a couple of times that you're taking one bottle, you need 2 bottles to give you the same desired effect that you've been getting before from one bottle. And subsequently, you will start taking up to 4 bottles, up to 5 bottles before you get the same desired effect that you're getting before with a bottle. So with that, people that start abusing opioids have the tendency to want to use more, consume more of the opioids than the ordinary people, okay? And gradually they'll become hooked on it, which you try to avoid. That's why we try as much as possible to de-escalate our postoperative analgesics from intravenous, which is more addictive, to oral ones. So with this, I think we'll be able to clear the air regarding analgesic use in the theater. Thank you very much, and have a painless surgery.
Oh yeah, good morning. Let me first take a sip of my coffee first. So we did a recent video and we saw some comments and we wanted to quickly respond to it. So some people saying something about smelling BBL. Oh wow, I don't understand. Well, the only thing I can smell is good people, nice looking body. Well, I don't think that is actually true. I don't know where they got all this trend, I don't get it. Maybe they had people that had maybe something like fat necrosis, or they had their butts, maybe there's an infection on the butts, so they have like a wound that is poorly cared for, that is smelling. Maybe that's what they mean. Otherwise, if it is the regular people that I see every day, there's no way after a BBL procedure you'll be smelling. Or maybe they are talking about the blood when the patient are still draining. Maybe that's what they mean by smelling BBL. So it leaves a lot for me, Otherwise, scientifically, I can't. It's still difficult for me to understand, because I have to go to TikTok and listen to some of them. Oh yeah, I have a friend, in my own simple scientific way, have a board certified plastic surgeon to do your BBL. If there are issues, speak with your doctors. maybe those who had butt infection following BBL, or maybe fat, even the fat necrosis doesn't smell. Even for patients who had fat necrosis, it will drain for some days and it will go, except maybe there's an infection. If there's an infection, definitely, and there's a wound, there's that tendency for that patient. Otherwise, there's something like smelling. I don't understand. Thank you. Yeah, good afternoon, and welcome to Grandville Talk. So today we'll be talking a little about importance of compression garments. The compression garment is a medical device that are worn by patients after surgery, either to compress area to reduce pain, to avoid bleeding under the area, and in some cases maybe for aesthetic purpose, but for a lot of times it's more to compress the area, reduce pain, and also reduce collection under the area involved. So it can come in different shape and sizes. We have compression garment for the face, for the chest. So like if we do buccal fat pad removal, chin liposuction, we have a face compression garment. For the gynecomastia also, we have that. That's for male boobs, for breast reduction, breast lift, for liposuction, for tummy tuck, thigh liposuction. We can mention a few of them. Now, how long do you have to wear your compression garment? I would say it depends on the surgery, and it also depends on the surgeon's recommendation for your procedure. So for many of them, averagely, I would say between 10 to 4 to 6 weeks, 10 days to 4 to 6 weeks. That's the average time you have to wear your compression garment. So for the face, within 2 weeks, it should be good. For gynecomastia, 4 to 6 weeks. For the abdomen, for liposuction and tummy tuck, can be on for about 4 to 6 weeks. Some patients also go out of their way to try to compress it a little longer. What we always recommend is a medical compression garment, because there are a lot of other compression garments outside there. So I would advise that you should only use a medical compression garment that is recommended by your surgeon or your healthcare physician. Thank you. Okay, so welcome everybody. So this morning we have this challenge. We have this lady. She has this part of her breast is empty. You can see the breast. This breast is not well formed. This is what we call a micromastia. You can see this breast is well formed. So what we are going to do is we've looked at the options we have. One is grafting this area, but the problem about grafting is that it might not give you that volume you are looking at. So we've sat down again and look at it and say, okay, we're going to use a breast implant. So I'm going to put an implant into this breast. The implant will give me a much more results, in the sense that this emptiness, the implant will give me that volume I'm looking at. It might not be as equal as this, but I'll make it as close as possible. That's all. So thank you. can see, so we have something close to this. So we might do some periareolar lift here. So you can see, so this is almost close to what we have on this end. So I think we are good, and probably put a little fat graft in here just to help the tissue in that area. Open in full, in full. So we've gotten to the decision area. So it has a motiva. So now I'm trying to reorientate it. Yeah. Retract up. Okay, so though, you know, so this is new, this is old and new. Thank you. So the emptiness is gone now. So we've done some what we call periareolar lift here. The real essence is to make sure that the nipple is almost as close as this. So we'll give it some time. We'll give her so that when she's leaning forward, it's not going to look awkward. So. Hi, good afternoon and welcome to Grandville TV. So today I'll be talking about mommy makeover, what is included, and recovery. Oftentimes people call in and say, oh, they want a mommy makeover. And oftentimes the first question I ask them is that, do you know what it means by mommy makeover? What exactly do you want to do? Because mommy makeover starts with as simple things as spheroplasty, neck lift, facelift, tummy tuck, liposuction. So basically what we are saying is that, okay, you have a woman after childbirth, she has a lot of changes that has happened to our body due to pregnancy. Aging also could also add to some of these things or these changes, and they are here to do those procedures. So things like breast, the breast has fallen, the tummy is big, there's all called diastasis rectal, there's a lot of flank fat, sometimes the thighs are big, so you want to do something about it. So each of these procedures can be done alone or in combination with another procedure. Now, the recovery time, usually, I would say 2 to 4 weeks. That's what we normally tell in terms of the early times. But during this period also, there's still going to be a lot of swelling. You know, this seems to be the most commonly complained things when we do surgery for patients. Doctor, I'm still so big. My tummy is still so big. And what we do tell them is that you just had this surgery within 4 days. You can imagine somebody coming in. Last week we had a patient that came in and said, oh, one breast is bigger than the other. So I said, okay, where's the picture? When she showed me a picture, the picture she was looking at, one breast, which is the right, was bigger than left. When we were looking at her, as at that time she's complaining, the left is bigger than the right. So you see, those swellings will be there for some time. Sometimes also the fluid we are using under the breast also add to those things. Apart from the fact that you are inflamed, your body will be inflamed. So the initial 2 to 4 weeks, which is where any form of incision that we have made, we are allowing it to heal. After that time, we now have the issue about swelling, wound consolidation, meaning that the wound getting much better. We also give specific instruction, don't do heavy lifting, don't do exercise, and a lot of things like that. So swelling takes almost like 6 to 8 weeks. So for you to totally see your body, it takes almost like 6 to 8 months for you to finally see the outlook. Yes, you can have 1 or 2 complaints. You can always go back to see your surgeon because these are imperfect procedures. How do we mean by imperfect? What we are basically saying is that we are not machine. Even when they are coming in to see us, one part is usually probably bigger than the other. So when we're also trying to do all we can, we're also looking at all those things. We take out more from one, we put a little more in the other. So these are things that we are doing. Sometimes it's painful when you see patient complain about, we just say, calm down, let swelling goes down. When swelling is gone, then we can reevaluate the whole thing we have done. Then we can decide on what best to do. So it takes a little while for your body to totally recover. So your mommy makeover will include many other things. It could be a single thing or many other things that concerns your body after maybe childbirth. So I wish everybody happy Easter. So good morning once again. Today I'll be talking about tummy tuck and liposuction. Which one is right for you? And I'm sure many of us are aware of liposuction, which is basically removal of fat from under the skin from specific areas of the body to create better contour or silhouette body. In some cases also, it can be an adjunct to a procedure. So an example of it is tummy tuck. In tummy tuck, while we are trying to repair the wall of the abdomen because of maybe childbearing, weight loss, bariatric surgeries, and a lot of things like that. So as an adjunct to that, we can also do liposuction simultaneously. So now, which one is right for you? So it depends on what you want to do. There are people that we also do liposuction for because we need to harvest the fat to recontour a small areas of their body. So I've seen a patient that has a deficient contour on the forehead. So I had to harvest fat to fill up that small area. There are people also that have maybe defects on the leg, maybe after an accident, and I needed to graft that area to create a contour. Now, however, for majority of people, when they are coming in for liposuction, they are doing it because they want to create a silhouette body, a more contoured body. So in that way, what you are doing or what you aim to achieve is to create a silhouette body by taking out fat from specific areas, usually the tummy, the flank, the back, and in some cases the arm, inner thigh, and in some cases you might need to also do grafting of the butt to get the result. Now, there are some patients that come. So this morning I'll be talking about how to prevent and manage scars after surgery. So I will say that scar management actually starts before surgery, not after surgery. How do we mean by starting after surgery? We want to find out how badly scar the patients do have before surgery. Some patients heal perfectly well, some don't. Some also are keloid formas. So you want to be sure of all those details before you go ahead to do surgery, and you want to counsel the patients about this. The other part is the pre-op condition of the patients. Patients in good health, making your incision along what we call the natural lines or Langerhans lines. That's what we call it. Following the instruction of the doctors after the surgery. Like we do have some patients, we tell them don't allow water to touch the surgical sites. Some of them will have their baths, and at the end of the day, you have wound infection or a breakdown of the wound. The other thing is that sometimes also wound breakdown can make a surgical scar being worse than what we plan or intend it to be. So, the other thing is that we can always manage scars after surgery, post-op surgery. So, the other thing is basically after healing, we want to ensure that we start the patient on silicone sheets or gel, and in some cases we might need to use steroids, some drugs, some things like microneedling, lasers, and a lot of other things. These are some of the small details that we'll pay attention to when we are talking about. It's also important on the part of the surgeon also to make a good suturing, meaning the closure has to be also fantastic also. So that at the end of the day, it's a combination of factors that decide the healing of the patient. So thank you. This morning I'll be talking about how to prevent and manage scars after surgery. I will say that scar management actually starts before surgery, not after surgery. How do we mean by starting after surgery? We want to find out how badly scar the patients do have before surgery. Some patients heal perfectly well, some don't. Some also are keloid formers. You want to be sure of all those details before you go ahead to do surgery, and you want to counsel the patient about this. The other part is the pre-op condition of the patient. Patients in good health, making your incision along what we call the natural lines or Langerhans lines. That's what we call it. Following the instruction of the doctors after the surgery. We do have some patients, we tell them don't allow water to touch the surgical sites. Some of them will have their baths, and at the end of the day, you have wound infection or a breakdown of the wound. The other thing is that sometimes also wound breakdown can make a surgical scar being worse than what we plan or intend it to be. Well, the other thing is that we can always manage scars after surgery, post-op surgery. The other thing is basically after healing, we want to ensure that we start the patient on silicone sheets or gel, and in some cases we might need to use steroids, some drugs, some things like microneedling, lasers, and a lot of other things. These are some of the small details that we pay attention to when we are talking about. It's also important on the part of the surgeon also to make a good suturing, meaning that closure has to be also fantastic also. So that at the end of the day, it's a combination of factors that decide the healing of the patient. Thank you. Okay, so for a lot of times when patients come in for consultation, some of the questions we do ask them is, do you smoke? Do you take alcohol? And some of them will be honest enough to tell you that, okay, I actually smoke. I actually take alcohol. Does this have any effect on you? Yes, it does. So smoking, when you smoke, it inhales some gas, carbon monoxide, some other components that are not. So apart from the fact that it damages the lungs, it reduces also the exchange of oxygen, and with poor exchange of oxygen, it also means that there will be poor healing. The second part, which is the nicotine deposit, because smoke or cigarette has nicotine. I'm not talking about marijuana. Marijuana will probably have more of the smoking effects, reducing the lung functionality. The other components of marijuana, which will give all the ecstasy, the euphoric effects and things like that. So definitely there will also be poor gas exchange from nicotine, which could be in the cigarettes, it could be in the shisha, or any other product that people are using, maybe tobacco and some other things like that. They are left in the blood for 6 good weeks. What it does is that after your surgery, you have what we call vasoconstriction. What vaso means vessel, constriction means reduce. So blood vessel reduction. So you can have blood vessel reduction to specific areas. So like if you have done liposuction now, you might end up with what we call lipoburn, because there's what we call peripheral vasoconstriction. The blood vessels will shrink a little instead of them to open at that point in time, because at that point in time, that's when the skin or the other organs need more blood supply. So, and with the fact that they are there in the blood, they will cause more shrinkage, which can lead to skin death, which will end up with a wound, which will end up with a scar. So the same thing with alcohol. What alcohol does is that it can affect, because the processing of alcohol is in the liver. Liver is one of those machines in the body that produce proteins. So apart from the protein you eat, it's also produce some proteins in your blood. So, and if you are now affecting that, it will affect healing, The same thing with the clotting factors, because part of the clotting factors also are related to the liver. So also it can affect healing, you know. So these are the reason why we tend to tell people 4 to 6 weeks, stop smoking. Minimum time 21 days, stop anything smoking, because it can affect your healing, it can affect your surgical outcome, apart from the other things like maybe cancers that we are all aware that they are associated with smoking. So thank you.
Your love is rated X. That means you're extraordinary.
Hi, good morning once again to our very beautiful what you need to know about what we do generally. So happy day to everybody. So this morning I'll be quickly discussing about follow-up on breast implants. We all know that breasts can be augmented, can be lifted, can be reduced. It can also be reconstructed. But this time around, we are talking about follow-up of breast implant, because this morning I've seen two different patients. One that I did breast implant for in 2009, or 2009, she said, 2019 rather. Then she did BBL 2020. So she came for follow-up. She's concerned now. She's had 2 kids, and the breast is a little saggy, which is expected. Now she wants to either remove the implants or keep the implant. So I have to explain to her, if there's nothing wrong with your implant, there's no need for us to remove the implant, except you want to reduce it. Now the breast is much bigger because of childbearing, so she definitely need a lift. Then if you want the implants reduced, you can reduce the implants. If you want the implant to be kept, you can. Now, let me just quickly talk about the follow-up. Within the first 2 to 4 weeks, all what you need is to allow healing along the incision site. The other thing are now going to be follow-up 6 months after, just to check, examined. And if you have after a year or 2, definitely you now start looking at other issues with the breast and the implants, which are things like rupture, capsule around the implants, which in some cases can become aggressive and become a problem, so which we call capsular contracture. So in that way, that implant needs to go out if there's a heavy capsular contracture around the implant. So I've only seen one in my practice, and if I go by my record, I think I should have done well over 200 to 300 breast implants. So I think that I will end on that. Then in the next video, I'll be talking about the long-term follow-up when it comes to breast implant. Thank you. Hi, good morning once again to our very beautiful what you need to know about what we do generally. So happy day to everybody. So this morning I'll be quickly discussing about follow-up on breast implants. We all know that breasts can be augmented, can be lifted, can be reduced. It can also be reconstructed. But this time around, we are talking about follow-up of breast implant, because this morning I've seen two different patients. One that I did breast implant for in 2009, or 2009, she said, 2019 rather. Then she did BBL 2020. So she came for follow-up. She's concerned now. She's had two kids, and the breast is a little saggy, which is expected. Now she wants to either remove the implants or keep the implant. So I have to explain to her, if there's nothing wrong with your implant, there's no need for us to remove the implant, except we want to reduce it. Now the breast is much bigger because of childbearing, so she definitely need a lift. Then if she wants the implants reduced, we can reduce the implant. If they want the implant to be kept, they can. Now let me just quickly talk about the follow-up. Within the first 2 to 4 weeks, all what you need is to allow healing along the incision site. The other thing are now going to be follow-up 6 months after, just to check, examine, and if you have after a year or two, definitely you now start looking at other issues with the breast and the implants, which are things like rupture, capsule around the implants, which in some cases can become aggressive and become a problem. So, which we call capsular contracture. So, in that way, that implant needs to go out if there's a heavy capsular contracture around the implant. So I've only seen one in my practice, and if I go by my record, I think I should have done well over 200 to 300 breast implants. So I think that I will end on that. Then in the next video, I'll be talking about the long-term follow-up when it comes to breast implants. Thank you. Hi, good morning, everyone. So this morning, I remember that the last discussion we had, I was talking about the skin in general. Basically, what I tried to do, or what I did then, was to talk about the structure of the skin. So this time around, I'm going to be talking about the type of skin. And I'm well aware there are different ways of classifying skin. But to many of us, the one we are very familiar with are things like dark skin, fair skin, white skin, dry skin, oily skin. Those ones are just, they are the general way of looking at skin. But the one we tend to use more in medical is what we call the Fitzpatrick classification of skin. So that the word Fitzpatrick. Now, the Fitzpatrick classification talk about the amount of melanin pigments you have in the skin. So we have it from type 1 to type 6. So why the people with totally no melanin in the skin will be referred to as the type 1. Then the type 6 are people that are really dark pigments. There is a popular musician that I normally refer to as type 6. Even sometimes when I'm making reference to someone like One Day Cole now, I would say it's a type skin. I've also seen some other tribes in Africa that are really dark pigments people. So I'll call those ones type 6. Well, however, there's a beauty in that dark pigment. Why? Because melanin is protective. So the way the body has been structured is such a way that whenever there's a UV light, which is the sun ray, when you get exposed to it, the body will try to produce more melanin to protect your skin from being damaged by the sun, because your ultraviolet light actually damages the skin and also can make the skin to develop cancer. So for those of you that are dark pigments, definitely it is protective. It has some amount of sun protection factor. We'll say a minimum of about 6 sun protection factor. So before you use your sunscreen, you already have some sun protection with being dark. And that's why if you look at your sun exposed area like the face, the hand, the feet, you notice that those areas are darker. The reason is because there are more pigments in the skin. I think for most of us in Africa, will probably be, except maybe for the white pigments or the white skin people, many of us will be between 4 to 6. So other things like maybe your skin being dry, that has to do with the amount of sebaceous gland production that will decide on that, But I want you to first realize that the skin being pigmented is protect you from the effect of the sun, which also invariably means that the risk of you having skin cancer is less. So that's why you tend to notice that the Africans tend to have lesser skin cancer in the sun exposed area, which is this part of their body. So there's a need for us to emphasize the need for use of sunscreen at this point in time. And let me quickly talk about it, that the sunscreen, we have two types. We have the physical, we have the chemical. And in some cases, we can have sunscreen that has the combination of the two. So in our clinic, we have the sunscreen that has the physical one. So I would advise that when you are going out in the morning, wear your sunscreen, and it should be on every sun exposed area of your body. That means your face, your arm, or your upper limb, and your feet. You should put a sunscreen. You can also use an antioxidant like vitamin C to protect your skin. Also, it's an antioxidant. It helps to protect from the effect of free radicals being produced by the skin. So your basic care about your skin is very, very important.
Good day, everybody. Today we'll be talking about weight loss approaches. A lot of people go on dieting. Some do keto diet, some do paleo, Mediterranean, all in a bid to lose weight. Some people even take green teas and the rest of them. Fantastic. But there are two key factors you need to understand. For every weight loss approach that you take, of course, weight loss is a question of how much calories you have taken and how much you expend. All right. Once you understand these two factors, it will be easy for you to go on any approach for weight loss. Now we're going to talk about the four major approaches to weight loss. The first is your diet and your exercise. Of course, you gain calories from what you eat. The only way or the best way you can expend these calories is through exercise or physical activity. You mustn't need to go to the gym. You mustn't need to, but if you can go to the gym, that's fantastic. You just walk around where you live. Of course, the WHO has said every individual must maintain 10,000 steps daily for at least 5 days in a week to maintain a healthy weight. The second approach is the Ozempic. You must have heard about Ozempic injection, also called the Mounjaro. Okay, originally, that Ozempic was prescribed for individuals who are struggling to control their blood sugar, actually. But the after effect of that Ozempic or Mounjaro is weight loss. That's why people go on it to lose weight. Then the third thing is the endoscopic balloon procedure. You must have heard about the gastric balloon, a procedure whereby we insert a balloon through your mouth to your esophagus down to your stomach, and we inflate this balloon. Okay, the balloon will take up space in your stomach, leaving you with just very little space for your food and your water. Then the last is a surgical procedure, an invasive, minimally invasive procedure per se. In the sense that the surgeon is going to make tiny holes on your abdomen to access your stomach. He's going to make a sleeve, cut out a huge chunk of your stomach, about 75 to 80% of your stomach, the stomach space, leaving you with only about 20% of your stomach space. Now, this procedure is such that your weight loss will be rapid. You can lose up to 40, 50 kg of weight. Then the next procedure, just like the gastric sleeve, is called the gastric bypass. As the name implies, bypass, we bypass a huge chunk of your stomach and then reset your intestine to the little portion of your stomach remaining. I will leave you with this information. Whatever approach you take for weight loss, remember, diet and exercise is at the bedrock of each and every one of them. My name is Chidibem Obichiri. I'm the dietitian from Grandville Medical Center. I will see you again. Bye-bye.
So good morning once again. Today I'll be talking about tummy tuck and liposuction. Which one is right for you? And I'm sure many of us are aware of liposuction, which is basically removal of fat from under the skin, from specific areas of the body to create better contour or silhouette body. In some cases also, it can be an adjunct to a procedure. So an example of it is tummy tuck. In tummy tuck, while we are trying to repair the wall of the abdomen because of maybe childbearing, weight loss, bariatric surgeries and a lot of things like that. So as an adjunct to that, we can also do liposuction simultaneously. So now, which one is right for you? So it depends on what you want to do. There are people that we also do liposuction for because we need to harvest the fat to recontour a small areas of their body. So I've seen a patient that has a deficient contour on the forehead. So I had to harvest fat to fill up that small area. There are people also that have maybe defects on the leg, maybe after an accident, and I needed to graft that area to create a contour. Now, but however, for majority of people, when they are coming in for liposuction, they are doing it because they want to create a silhouette body, a more contoured body. So in that way, what you are doing or what you aim to achieve is to create a silhouette body by taking out fat from specific areas, usually the tummy, the flank, the back, and in some cases the arm, inner thigh, and in some cases you might need to also do grafting of the butt to get the result. Now, there are some patients that come in confused about, oh, what should I do? And when you examine them, you realize that, okay, yes, this person is desirous of liposuction, but what is best for that person is a tummy tuck. We tend to notice this tends to be more common among post-pregnancy, post-delivery also, let me put it that way. After you've carried the baby, 2, 3, even 1, and the tummy is all over the place, is bigger, you notice there is excess skin. When you stand, you notice that there is skin, flanking down the pubic area. There's also what we call rectal diastasis, where the muscle, the central muscle, which we call the recti, or the rectum muscle, or rectal muscles, have drifted away. So in that way, such people will need a tuck. In tuck, what we do is we take out the excess skin, we repair the wall, which is we try to bring the rectus muscle to the center area, to what we call application. Then we try to bring down the skin down into the pelvic area, let me put it that way, or the inguinal line, or the normal natural line of crease. Simultaneously, we do liposuction of the flank and back, just to create a more silhouette look. So you could also have this in post-bariatric or post-weight loss patients that have lost tangible amount of weight, significant amount of weight, like 10 kg, 20 kg, 30 kg. Now they have excess skin in the tummy, on the back, on the arm. Definitely such a patient will need a tummy tuck. I've also seen patients who are born with abdominal back defects, where they have defects in the central area, we have defects, so they are not comfortable with it. But oftentimes what I try to counsel people is that when they have not started having children, I try to encourage them to wait till when they are done with childbearing. But there are some people that will say, no, I cannot wait. So we have no other option than to take out that excess skin, try to repair the wall, then they're happy with their result. So I think I'll stop. If you have any comments or question, please put it under this post. Thank you. So once again, good morning. I have before me an implant, a breast implant by Motiva. This is what a typical breast implant looks like. And you can see on this is written sample, meaning that it cannot be used for any human. They are just sample. We have other brands, but this is the one we use more recently. Now, I am talking about breast implant safety. What you need to know. The first thing you need to know is that, one, breast implant can be used for both aesthetic and reconstruction. The aesthetics, we are talking about breast augmentation as an aesthetic procedure. However, in reconstruction, we use it in maybe post-mastectomy. Maybe people that have a breast cancer, they have had their breast removed and they are getting their breast augmented. It can also be used in congenital disease, like in patients with micromastia. There are some women that have very small breasts, and they are here in the clinic complaining that the breast is really small. One breast is small, the other one is big, so you can reduce one to match the other one. However, if the other small one is really small, you might need to use an implant to do that. Now, breast implant can be classified into two, which is one, the saline breast implant. When we say the saline, which is saline, we call it saline in Africa, it means what is inside will be that fluid that we use to give into your body when you are ill or when you're in the hospital, or silicone. So this is silicone inside this. In the past also, there used to be textured implants. When we say textured implant, they have like a rough surface on it. That's the textured implant. However, in this our clinic, we use silicone shell, silicone gel inside. And this is a 4D, meaning that even if you break this, if you tear these implants, the shell, the silicone, they all stay in the same position. The reason being that they have very strong coercive force. After your breast implants, can there be complications? Yes. Complication can be things like hematoma, which is blood under the area where the implant is put. You can have what we call capsular contracture, where your body more or less rejects with a lot of fibrous tissue around the implant, causing implants distortion, and in that way you might need to can have infection of the implants. I've seen one hematoma, but it was minimal. We don't need to do anything. We've never seen infection in the clinic. We've seen one capsular contracture in the clinic, and the only option is to take out the implant. That's the option you have. You also have the option of putting back the implant. However, you're going to put some other biological shell around the implant so that the body does not form aggressive healing around the implant. The implant also can rupture. If it's the saline one, what will happen is that the breast will go flat. If the silicone one, you will basically not see anything. You understand? So what are the things you should do also after your breast implant surgery? You need to do routine check, since that you use either MRI or ultrasound. The gold standard is usually MRI. However, with the advent of and resolution of ultrasound is going, because it's cheaper, is going the way of investigation. Implants also should be changed within 10 to 15 years. We know that implant can actually last longer. Your breast health is also very important during this whole period. I will also advise that when you are doing your implant surgery, you should seek a board-certified plastic surgeon to do your breast implants. Then you can follow up with the doctor. Thank you for listening.
Hello, Dr. Ayo.
Hi, how are you doing?
I see you're watching tennis.
Yes, well, this is Australian Open, and I'm a strong supporter for Djokovic.
Okay.
So for now, that's what is it.
Okay, so I'd like to ask you about normal skin, if you can educate us.
Okay, so yes, it's really nice seeing everybody, and good morning. So today we'll be talking about the normal skin. Well, we all have skin. The skin has a lot of function, and if we know which I believe all of us are aware. So I'll just simplify it in a simple way. So one, your skin actually has multiple layers, but I'm just going to dwell on 3 layers of the skin, which is the epidermis, the dermis, and the subcutaneous layer. Epidermis, that's the top layer of the skin. The dermis is where you have majority of the structure in the skin. Then subcutaneous layer also have some blood vessels, but there are some blood vessels that runs in the dermal layer. The pigment in your skin also is in the dermal layer. Majority of the skin renewal happens on the top layer, which is the epidermis. So, which are the common structures, or let me put it, structures that can be affected when there is injury to the skin? The hair. like on the scalp area, if you have a scar on the scalp area, you can have what we call alopecia. We call it scar alopecia. In the dermis, pigment. So sometimes there are some people that have maybe burn injury or some other injury that can depigment the skin. So, or sometimes they are born with a skin without pigment. So they have vitiligo, or which could be congenital or acquired. So now there are a lot of topics that can go around. So, okay, your nail also could be part of your skin. It's also a part of it, not could be. It's also part of your skin. So sometimes when you have nail infection, fungal nail infection, because these are things that are applicable in our clinic. So you might need to do laser on it. Sometimes they might need to give you fungal drugs to take care of the nail infection. So the other thing is the hair growth. Some people growing hair in specific areas, like women growing hair in common areas, and they are not comfortable with it, like the bear area, the pubic area, the butt area, the leg, the armpit area. Definitely you can do laser hair removal for that, to take care of that. Now for me also as a surgeon, you can have what you can have burn injury on the skin, and the skin has a protective function. So the protective function is lost. So in such a case, there may be need for intervention. Other function of the skin, thermoregulatory function. So in that way, that's the reason why you sweat a lot when you are in the sun or when you are hot. So it has a thermoregulatory function. So I think I will just stop there on the function of the skin. So see you next time. Thank you. Yeah, good morning, great team of Grandville. So while we see the organization transform into a greater healthcare system, we'll be introducing different things at different times in order to foster unity, to encourage engagement of staffs, and to bring out the best in each other. So to kick off this morning, we'll be starting what we call a staff engagement platform, which we'll be sharing either through WhatsApp or Zoom meeting. So I'll be starting by introducing myself as Dr. Ayo Aromolati. I'm a plastic surgeon of Grandville. I prefer to be called Dr. Ayo in my place of work. So I will expect every staff to introduce themselves through via text, telling us who they are and what they do for Grandville and their preferred name. In addition, at interval also, we'll be tagging staff to tell us what they do on individual day per time. I'll also be sharing engaging videos every week in order to carry everyone else along. Please let us all know that it is very important that we follow all these things in order to foster unity, grow the organization, and be our best. Thank you. So good morning. I've been asked a question to talk about what makes a great experience for patients in Grandville. So for me, I think I will refer to a great experience starting from time of making inquiry, time of being booked, and this things has to be timely. So if I'm the receptionist, I want to be sure that I'm in my best mood attending to my patients or the person making the inquiry by answering them and giving them right information. In some cases, giving them right price, booking them timely, trying to work out the best time for the patient to see the doctor. The other phase is when the patient comes in for consultation, the patient being warmly welcomed into the hospital, the work environment or the office environment being in the best position so that the patient feels right. Walking into the doctor's room, the doctor attending to the patients warmly, answering all our questions, ensuring that all the gray areas are properly cleared, and then sending the patient to do the right investigation after paying for or deciding to do the surgery. Because these are factors that affect decision making by the patient. So the other part is that in the laboratory, how the patient is being treated, asking them the right question. Okay, how are you doing? Okay, I'm going to do this. Telling the patient what you want to do. The same thing applies on the day of the surgery. They come in, signing their consent. All the questions are asked, ushering them to see the doctors seeing them, taking them upstairs, ensuring the rooms are clean, the toilets are clean, the theater is looking nice, everybody's conducting themselves professionally. So it's a whole package, not just attending to the patient on a medical basis, but overall, telling the patient, making the patient be in the right mood. So that's what I'll call a great patient experience at Grandville. Thank you. So it's a beautiful day. So we'll be having a patient who will be doing a facelift. Yes, you heard me clearly, facelift. And I know that for so many people, they don't know that actually facelift is actually being done in Nigeria. Yes, people do facelift. When we started our practice, one of our fears when it comes to facelift is scarring. Over the years, we realized that the scarring in that area is usually fantastic. We are not saying that people can't scar badly after a facelift. And in facelift, there are different types. There's a skin type, there's a aponeurotic type, there's a muscular type, depending on what is being done. Now, what are indications for facelift? We have people with what we call the turkey goblet, saggy neck, saggy face, and in your 50s or in your 60s, if you are able to pull your skin backward and notice that there's a rejuvenation of your face, you probably need a facelift. Now, in facelifting, in medical parlance, they will say it's a misnomer because facelifting should actually involve the forehead lift, the mid facelift, and the lower facelift. The lower facelift, which will include neck lifting, while the mid facelift is to take care of everything within this region. In a proper facelift, the incision starts from somewhere in the temporal region around the ear, then back to the back of the ear. The whole essence is that you want to keep the scar along the hairline here, then there is the tragus, then all the way to the back so that you can have the scar. Some dissection is done all the way into the neck area in order to redrape the skin. Then if you are using the aponeurotic muscular type, you make a little more incision to elevate the aponeurotic system, aponeurotic muscular system, in order to be able to drape this face much. There are also some dissection under the skin, but while you are doing this, you also want to avoid some certain nerves so that you don't damage certain nerve while you are doing it. In our own practice also, we do what we call hemostatic net. So you might see a patient, we have like multiple nets on the neck. The whole essence is that we are trying to close up the space so that blood accumulation will not be there. Average time for it's about maybe 3 hours, 3.5 hours. And then patient is kept in the hospital maybe for a day or two before being discharged home, asked to wear facial garments, see in the hospital where the hemostatic net is removed 5 days after. Then the dressing and every other thing is being done. So this is just a short story about neck lift. I can't explain the other details. So if you want more details on facelift, neck lift, send us a DM. Thank you.
Red guy, congratulations. So I say madam don't finally carry belle. You do well. I just want to reason with you one or two things where important for this matter. I know say economy not really pure as it's supposed to be. Yes, if I sabi. But I just want to ask you. Now the reason where you carry madam go register for that kind of place. Emergency now for night, you won't call that doctor within that place. 2 a.m., 3 a.m. Anybody go pick your call. Person go fit give them solution. I'm not do like that now. Your picking. Correct, but fine girl where you go born very, very soon. Now you go carry them, go put for that kind of place. But they do like that now, bros. Carry your wife and picking, go correct center. When they say on how you they put call 2 a.m., 3 a.m., any emergency, 24-hour round the clock service, obstetrician, gynecologist, there for you. But they do like that now. My name, now Dr. George. This place, na Grandville Medical and Laser. No talk, sir, I never do anything for you. Oh yeah, now you go be.
At the heart of every recovery is care that never rests. Welcome to our state-of-the-art intensive care unit, where every second counts and every life matters. Our ICU team is made up of highly trained specialists working around the clock to provide critical care with compassion and expertise. Equipped with cutting-edge technology and a focus on patient safety, our ICU is designed for rapid response and recovery. We believe in healing not just the body, but also the human spirit, supporting both patients and families in the hardest moments. Learn more about our critical care services, because when it matters most, you deserve the best. And at Grandville, we give you
All my plenty pregnant women, I just want hello now. Today, hold your 2 ear like this. So I want tell you all the machine where you no suppose near for this your pregnancy. So this one, na computer tomography machine wey they call CT scan. No make your 2 left leg near this place. So it contain better ionizing radiation wey fit harm both your pikin and yourself. And by the time wey you go don born that pikin, you go carry hand like this. God abeg o, no be the kind thing wey you want. That's why we say if you even born the pikin, make I go show you another machine wey you suppose dey very careful as you dey near am o. My people, this side wey we dey now, oya show them. Film the x-ray machine, film the x-ray console. This place na x-ray they call am. Abeg, no go carry yourself come here o. E dey very dangerous for you, especially if you dey your first trimester. The first aware like David wey wan go fight Goliath, na so we dey take protect ourselves from the radiation wey dey come from this thing o. Abeg, for woman wey dey pregnant your first trimester, you no suppose get anything to do with this side o, unless say doctor talk say e dey very important. E no get any other way wey dey go fit do am, na im fit bring you come this side. If you dey your second trimester, your third trimester, maybe you fit do am o, but make your obstetrician and gynecologist be the person wey go tell you say do or make you no do. E get another one wey I wan show you. Follow me still, we dey come. My people, this one na the MRI machine, magnetic resonance imaging. Abeg, especially if you dey your first trimester, I know say this machine dey friendly, e dey calm, but make e be your obstetrician or gynecologist wey go tell you make you do or make you no do o, whether you dey second trimester or even third trimester. Still tell them o before you do that thing wey you wan do. Finally, if you get piercing for nose ring o, ear ring o, and any other ring wey you, your husband and God sabi where you put am, abeg try comot them before you enter this machine. E no dey hear any word o, e name na magnetic, and as far as that thing be metal, e fit magnet am o. My name na Dr. George. This place wey I don show you so na Grandville Medical and Laser, and if I no tell you these things, nobody go tell you o. I'ma see you some other time. Bye for now.